colon cancer is killing more young people. A recent study released by the American Cancer Society shows a steady rise in colorectal cancer among young people. Colon cancer has seen a decline in reported cases overall, but reasons for a rise among young white individuals remain unknown to researchers. Rebecca Siegel analyzed colorectal cancer mortality among persons aged 20 to 54 years by race from 1970 through 2014 using data from the National Center for Health Statistics, representing more than 99% of deaths in the United States. The study was published in the Journal of the American Medical Association on 8 August 2017. The study claims that reported cases have increased by 1.6% annually in adults younger than 50. This finding can be traced back to 2004, which is when the first spike in colon cancer among individuals under 54 reportedly occurred. The increase in young adults followed a decade of rapid declines during the late 1970s and early 1980s. The study's discovery is only seen in Caucasian individuals between ages 20 to 29, which puzzled researchers because African Americans are more prone to developing colon cancer. However, death rates for African Americans who had colon cancer fell during the study period from 0.4% to 1.1% annually. Colorectal cancer incidence rates in blacks were about 20% higher than those in non-Hispanic whites and 50% higher than those in Asians and Pacific Islanders. While the study did not focus on individuals of Ashkenazi Jewish descent, the Norton and Elaine Soneff Center for Jewish Genetics claimed that Ashkenazi Jews have higher rates of colorectal cancer than any other ethnic group. Gender disparity is also not understood by researchers at this time, with cancer researchers finding that men are 30% more likely to develop colon cancer than women. Although the risk of colorectal cancer remains low for young and middle-aged adults, rising mortality strongly suggests that the increase in incidence is not only earlier detection of prevalent cancer, but a true and perplexing escalation in disease occurrence. Rebecca Siegel, an American Cancer Society investigator of the study. It is especially surprising for people in their 50s, for whom screening is recommended, and highlights the need for interventions to improve use of age-appropriate screening and timely follow-up of symptoms. Preventative colonoscopy exams have led to a decline in colon cancer cases, but some studies suggest that preventive exams do not necessarily help to stop colorectal cancer in its tracks. A 2016 study published in the New England Journal of Medicine claimed that colonoscopies do not deserve sole credit for preventing colon cancer because the screenings are not capable of determining everything. The majority of people undergoing screening are neither identified as having cancer nor protected from its developing, but they often endure repeated colonoscopy for surveillance of small polyps. Colonoscopy is the most common method to screen for colon cancer. According to U.S. Preventive Services, colon cancer screenings are recommended for individuals ages 50 to 70. However, the American Cancer Society's findings may change the recommended testing age. There are recommendations in place for children born to families with high rates of colorectal cancer. If the colorectal cancer in the family was diagnosed at a young age under the age of 50, or in a first-degree relative, parent, sibling or child. Heavy alcohol and tobacco consumption, lack of physical activity and low fruit intake are a list of factors that have been linked to individuals who developed colorectal cancer, according to the Colon Cancer Coalition. However, American Cancer Society noted that obesity is a risk factor that is universally increasing. Thank you.